Okay, she's right where I want her. I'm comfortable, she's comfortable. It should be pretty straightforward. I'm going to make sure that I'm applying traction to the area so that when I inject, it's going to go in there nice and smooth. There's no struggling. I know exactly where I'm going. I'm not going to be approaching it with one hand and my other one down here. I'm going to put one hand here and apply traction. I'm going to do what's called a linear threading pattern. So I'm going to put, here's the righted or wrinkle. I'm going to put one here, 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 and then I'm going to come back and lay it on top of that, called a crosshatch. Okay, so let me just put a little more ice on there to make sure, because this is really the only anesthesia we're using here. Obviously, it can be a little uncomfortable, so we discussed the procedure beforehand when we obtained our informed consent, and she understands that this is going to cause a little bit of discomfort. I actually have another ice pack I'm going to use as well. An alternative form of anesthesia here would be to have her apply EMLA cream, that's EMLA cream, 1 hour before the procedure. That works pretty nice as well. The way I like to do it is 1 hour before her procedure, we apply it, and then we apply it every 15 minutes until the procedure, and put a nice volume of the EMLA cream on the area to be treated. And that can provide some nice topical anesthesia. There's really no blocks that are commonly used in this area, as there are with the lip augmentation and the smile line correction, or the marionette lines where you can use a mental nerve block. Okay, so that's that part. We're going to go ahead and proceed. Okay, Michelle, you're going to feel a little poke, hon. 1, 2, 3. And again, I'm mid-dermis, not too superficial. I'm coming across the line and injecting. And then I'm going to come right down this way. I'm mid-dermis. I can feel the needle in the dermis. There's a lot of resistance to me pushing the needle forward. If the needle flowed easily, if the needle was able to be entered easily, I would be too deep. And we'd probably notice a result because the volume would be there. But if it's in the subcutaneous tissue, it's degraded rather rapidly. Now on my way out, I'm going to just lie down a little line. And a little poke, coming right across that crease. And as I come back, I'm laying that linear thread down.